everybody, this is Becca, and I am going to do an IV start for my demonstration speech this week. I am a nurse at Genesis Medical Center, and I work in labor and delivery. Side note, this is our simulator doll, Noelle. She is something that we use to go use in emergencies to practice, to simulate those things that we need to be proficient at. And we also can start IVs on her and do all kinds of things. So she is my patient today. Just a quick spoiler alert, there are going to be a couple of needles in the shot. So if you get queasy about that, I just want you to know that you will see a couple of needles. You will not see any blood, as Noelle does not bleed. At some point in your life, you probably will be in a hospital as a patient. Most likely you will have an IV a few times in your life. So I just wanted to go through the process that we go through to start an IV. So I'm going to first go over the materials that we use to start an IV, and then I will talk about a couple of medications that we use, and then I will show you how to look for a vein and get an IV hooked up. So the materials that we use the same ones for patients. One step back real quick. The source that we use at the hospital to get procedure information is called Lippincott. It is a journal subscription that the hospital has. And for any procedure, anything that we're going to do, we've got that available to us 24/7 online to look up the steps to a procedure. So to gather equipment for an IV, we would get an IV start kit, and it has a tourniquet and some cleaning supplies. It has tape, and it has adhesive in it to get an IV. We also would grab IV needles, IV catheters, and I'm going to talk just a little bit about an IV catheter. I always explain to my patients. So an IV catheter, this is what it looks like. This is how we start the IV. And if you can see it, and I'm not sure that you can, there is a needle on the end here, and then it is covered in a white catheter. Once we get that IV in your arm, we actually slide the needle back into this chamber here, and then you've just got this catheter that's kind of bendy and flexible in your arm. So you can move your arm around, you're not going to get stuck, you're not going to hurt anything. So just a little side note about the IV catheter. Then I've got just a couple of things of adhesive, and then I've got my IV tubing. So we hook up this tubing, and the next thing, the couple medications that we use, IV fluid is considered a medication, even though it really is primarily used to hydrate you and just to keep you hydrated while you're in the hospital. This is considered a medication. The other medication that we use after I've gotten my tubing all hooked up and flushed with the fluid, the other medication that we use is in a little tiny syringe. It's called buffered lidocaine, and it is to numb the spot on your arm where we're going to stick. That IV catheter is normally pretty large and painful, so we stick you with just a teeny tiny needle and put some lidocaine in there to numb it up for your comfort. So next I'm going to show you how to set up. Once I've got all of my equipment set up on the table here, I explained to Noelle, I'm going to start an IV. Your doctor's ordered one for you to be in labor today. So I wrap this tourniquet around her arm and I pull it pretty tight. I would say patients do not like a tourniquet very much, but we pull it as tight as we do because it slows down your blood flow in your arm, and it really puffs up those veins that we need to see in order to start the IV. So as I put that tourniquet on, I can see on patients their veins start to get really, really big and look like night crawlers in their arm. And that's how I can search and figure out which vein I'm gonna go for. And I see a nice one right here. It's nice and straight. I can follow it all the way up her arm. Doesn't have any crooks in it. Doesn't bend at all. Some people, you may notice, have little bumps on their veins, and those are called valves. We don't want to stick a vein that has a valve because we can't go through the valve. So now that I've decided on the vein I'm going to use, I would get my buffered lidocaine. First of all, I would get my gloves. Gloves, gloves, gloves. You have to wear gloves anytime that you're going to be exposed to blood and body fluids on a patient. So gloves on. And I'm going to clean the spot on her arm. You never know what's on people's skin. So this gets any bacteria, any dirt off. You do it for 30 seconds. And then we would wait for it to dry. Yeah, usually air dries in about 10 seconds, I would say. My buffered lidocaine, I'm going to go ahead and just stick her arm very light, just right underneath the skin. And as I push that lidocaine in, it's just going to make a little bubble there, and that's my target of where I'm going to stick. So I feel my vein one more time to make sure that it's, yep, still there, still feels okay. Sometimes people's veins roll, sometimes they go away, you can't see them. You just want to make sure before you poke them that everything still feels like it did before, and it does. So I would uncap the IV, and I'm just going to hold it at about a 45-degree angle. Go right through that target of the numbing medication, poke, and there's kind of a, you feel kind of a give once you get into that vein. And also on a real person, I would get some blood that flashes back in this little chamber here, and that lets me know that I'm in the vein. So I would go ahead then and push the catheter forward, and I'm going to just pull that needle out. It makes a clicking sound. I'm going to undo this tourniquet because if I uncap this, Noelle's going to bleed everywhere. So tourniquet's off, so that pressure is off of her arm. Go ahead, and I'm just going to disconnect that IV catheter by turning it, and I'm holding some pressure right by that catheter so she doesn't bleed, and I'm going to hook up that IV fluid. So that tubing is all hooked up, and I would go ahead with this roller clamp here, turn the fluid on, and the fluid would start running. I would then fix the IV to Noelle's arm so that she can move it comfortably and not pull the IV out, and she can keep it the whole time that she's in labor. So what I went over was the materials I use to start an IV, the medications that we use, and then how to properly find a vein and be successful at starting an IV. So I hope that this gives you a little bit of information that you'll find useful if you are ever a patient in the hospital and you need an IV. And hopefully it takes some of the fear away. And don't ever hesitate to ask questions. If you're a patient and you want to know what we're doing, we're happy to tell you. So thank you.